How does CBT help with separation anxiety? Have you ever wondered how cognitive behavioral therapy can assist with separation anxiety? This form of therapy focuses on changing thought patterns and behaviors to help manage anxiety. When it comes to separation anxiety, especially in children, cognitive behavioral therapy can make a real difference. First, let's talk about identifying negative thoughts. Children often have specific thoughts that trigger their anxiety when they are separated from their caregivers. For example, they might think, "I will be alone forever," or "something bad will happen." Cognitive behavioral therapy helps children recognize these thoughts and understand how they affect their feelings and actions. Once these negative thoughts are identified, the next step is changing them. Children learn to replace those anxious thoughts with more rational ones. Instead of thinking, "I cannot be away from my parent," they can learn to think, "I can handle being apart for a little while." This shift helps them view separations as less threatening. Behavioral changes are also a key part of cognitive behavioral therapy. Children learn to face situations they usually avoid due to anxiety. For instance, if a child is scared to go to school without their parent, they can gradually practice being away. This is where exposure therapy comes in. Exposure therapy is a vital component of cognitive behavioral therapy. It involves gradually exposing children to situations that make them anxious, like being away from their caregivers. This exposure is done in a safe and supportive way. Over time, children become more comfortable with these situations. Systematic desensitization is a technique used in exposure therapy. It starts with small steps. For example, if a child feels anxious about being left at school, they might begin by being left for just a few minutes while their parent stays nearby. As they become more comfortable, the time can gradually increase. Parental involvement is also important in this process. Parents can provide emotional support and encourage their children to practice coping strategies. They can help their child engage in activities that might otherwise be avoided due to anxiety. From a cognitive behavioral therapy perspective, understanding how thoughts influence anxiety is essential. By changing these thought patterns, children can develop healthier ways of thinking and behaving. This approach helps them manage their separation anxiety more effectively. In summary, cognitive behavioral therapy, through exposure therapy and systematic desensitization, offers practical tools for children dealing with separation anxiety. By addressing negative thoughts and gradually facing fears, children can build resilience and coping skills that reduce their anxiety over time.